Hi everyone, welcome again to Chats with Dr. Keke. I have my friend with me again.
I'm Kitom Kubata. I'm also a doctor and a pulmonologist, like
Yes,
Dr. K.
yeah. So the other Dr. K. So what we want to talk about is the devices that you might use for your child when they are wheezing. So just to say that children wheeze for all sorts of things, right? All sorts of reasons. During the winter season or during the RSV season, they may have bronchiolitis and they may wheeze. Okay, just a side joke. So there was this other influencer whose child got sick, and her whole thing was like, Barry, my child, it does not pneumonia, it was RSV. I was like, okay, that's just the virus, but
very important
nah,
that people to their kids that their kids not have pneumonia.
nah. So it was just RSV, not pneumonia. I was like, wow, okay. So your child can wheeze when they have bronchiolitis, but also when they actually have asthma. So it is a real thing. It's the commonest chronic condition in our country, in children. So it's fair that when you get that diagnosis or we do prescribe inhalers for your child, that you know how to use them. So one thing that a lot of moms love, and it's fine, understandably so, I also am now part of the club, are nebulizers, right? So people buy these devices, gadgets, and use them, whether their child has asthma, whether their child has a runny nose, it's okay. So I've made peace with the fact that people use nebulizers. I just want to explain, though, that there is a difference between the nebulizer at home and the nebulizer at the hospital, which is why probably at the hospital your child, or in casualty your child, will look better sooner, and that is because the medication in the nebulizer is actually being blown through by oxygen. So in the hospital, this cord will be connected to a socket in the wall that's connected to oxygen, whereas at home the machine will be plugged into a socket electricity and it will be driven that way, and so your child is really only getting air from the environment and then whatever medication that you put in. So nebulizers are not better than inhalers, right? So these gadgets that Dr. Gito will tell us about, they really are not. But I suppose why, as moms, especially of younger babies, we like them is because babies tolerate them better. So in terms of the spacer and the mask, the fact that you have to create a seal around the child's face, most babies will actually resist or turn their face away. Whereas with a mask, you can just put the elastic around the baby's head and keep it there, or you can literally just hold it close to their face, and as the steam comes out, they'll inhale it. So you will get this, and then we will say you can use just saline water, which you can get from any pharmacy. That doesn't need a prescription. But the actual medication that you will then put in the nebulizer, you need it to be prescribed. Some shady pharmacies actually give it without prescriptions. So there's the salbutamol, which is the medication that is supposed to help open up the airways. I just want to show you guys what these things might look like. So this one is Pulmicort. It's the steroid. Usually for children who actually have been diagnosed with asthma. So broncholytics do not need a Pulmicort unless they are in hospital or things are very severe. And then all your medication that you're going to put in your nebulizer will be mixed with some saline. So you'll get a prescription, something like I will say to you, okay, take 1 ml or 2 ml of the saline. So you'll take your saline and you'll take a syringe and then you'll draw 2 ml. And then you will pour it into this chamber in the nebulizer. There's a little opening at the top. You'll pour it in there. And then if we're saying use your saline and your Duolin, and then I'll say plus 1 ml of Duolin, then you'll take your Duolin, you'll draw up a ml of that, and you'll pour it in there. So then you'll have this mixture. But depending on how big your child is or how bad they are, there are other medications that could be put in there. Your doctor will tell you. And so you'll put this on your baby's face and then you'll switch the machine on and it will make a very loud noise. I just want to give you an example. You know how loud they get? Like, not fun. So just that sound alone could scare your baby, but they generally will tolerate it. And you'll see the liquid in there, it will mist up and it will steam and bubble and it will start coming out. And you want to get your baby to inhale as much of that as possible. The one disadvantage of the nebulizer is that you will also see a lot of the medication getting lost into the environment, okay? So every now and then you'll hear that wonderful beeping noise and just remind everyone what that's all about.
So it's probably because it's lunchtime and my son is eating and yeah, it's the alarm telling me he's either high or low.
Okay. Yeah. So that's a nebulizer. And if your child has asthma, they can't only be on nebs at home. You can't, if there's a doctor who just prescribes nebs for your child and that's it, they're not on inhalers, then it's either your child does not have asthma or your doctor is not treating your child adequately. And when in doubt, ask for a pulmonologist. Okay, so those are nebulizers. But if your child really does have asthma or your doctor says no, your child has like a viral wheeze, like every time they're sick they'll wheeze, we might prescribe inhalers. So Keith is going to tell us about those and the devices that we will use.
Okay, so inhalers are basically medication that gets delivered into your, it's designed to get delivered into your airways. And then the way they've designed it is to get to the smallest part of your airways. Like if you think about your airways, they basically go from big branches and they become very, very small branches, sort of like branches in a tree, right? And how these things are designed is to reach even that smallest branch. And these are called metered dose inhalers. But you'll notice if you pull it out is there'll be a number here, and that number will tell you exactly how many micrograms is in each dose. So when you do this, we can assume that 50 mics went out, right? So in children, I think we all maybe knew somebody in high school or primary school that had asthma that used these inhalers. They probably used them incorrectly, but that's another
the ones
thing.
on TV.
Yeah. Yeah. But for children, the whole principle of it is to press and inhale at the same time, which is almost impossible to do. They actually did studies on adults and they found that most adults, I want to say about 60% were using it incorrectly. So if adults struggle, then kids are definitely going to struggle, right? So we then have these devices called spacers, and lots of the spacers will have masks that we use for children so that it can deliver the medication into the child's lungs and they don't need to coordinate their breathing to do so. So with these particular ones, it's a very, very important to shake them because they're aerosolized and the drug kind of goes in the dependent areas, and you want to make sure that the dose that you're giving is the correct one. So you shake it to do that, and then you attach it to the back of your spacer device. You can use any spacer device. Sometimes if for instance your spacer breaks, you're on holiday, you can use a Coke bottle. You just cut out a nice snug hole that's gonna fit this thing at the back of your Coke bottle, and then you can use that. And you basically put it over your child's mouth and nose, and you do the same thing. However much your doctor has said, whether it be you always go one puff at a time, right?
I always say no double pumping.
No double pumping, yes. No double pumping. But you basically spray it in and then you count up to 10. Some pediatricians or some GPs will say up to 5. It honestly just depends on the size of the child and how deep their breaths are. I usually just go 10 because it's safer, because then I'm sure that they're going to get whatever I prescribed. And then, so let's say your doctor prescribes 2 puffs, so it'd be that 1 puff, 10 breaths. and then another puff, 10 breaths, right? And yeah, they have different functions, but your doctor should actually talk you through what the functions are. Is it to open up your lungs, or is it to treat the inflammation in your lungs?
Yeah.
So those are your lungs.
Okay, and so a condition that, for me, I just tell my patients always kind of 99.9% of the time always goes with the asthma, is allergic rhinitis. So this is where they sneeze a lot, their noses get blocked a lot, they scratch a lot, and they'll even get like that crease across their nose. Others make that sound and they do the scratching thing with their ear. So that's allergic rhinitis, and what it can do, it can cause a postnasal drip. So that mucus that's up in the upper passages can also irritate the throat and the airways and aggravate the asthma. So if you don't treat that, the asthma won't be under control. So there are nasal sprays that are used to treat that. But because I love you, before we talk about the nasal sprays, I'll let you talk about the importance of washing out the nose before you spray the nasal sprays.
So this is something that's like that I'm super passionate about. I think mainly because up until I knew about it, I also was treating it incorrectly. But you can't treat allergic rhinitis without rinsing the nose. And yes, it's traumatic. And yes, no one likes it. But unfortunately, that's the only way you're going to get that mucus out. Fortunately, they have very nice ones out now. I think Salix is the one that I usually go with, but they're different ones. But basically, what it is, it's a bottle with a nozzle, and you basically fill up the bottle with the contents that are in the box. It's usually a sachet and a little thing called surfactant. It looks like a nose drop, it looks like eye drops. You basically mix it. It has to be lukewarm water because nobody wants cold water up their nose. And you basically squirt on the side, it comes out on the side. You squirt on that side, it comes out on that side. And that's what you have to do before you put in the nasal steroid or whatever treatment it is.
Okay, so can I do that on my 7-month-old?
No. So it's typically advised for kids over the age of 1. I usually actually go 18 months to be safe. That's simply just because the communications between the ear, the nose, the throat are actually like underdeveloped at that point, and it hasn't really been studied in those kids because, I mean, who's gonna give up their kid to be a guinea pig? So it's the safety there it hasn't been proven, but in all honesty, there have been some ENTs who will prescribe it for kids under 1 if it's severe. Yeah.
Okay.
Yeah.
So, and then I think, well, it's important to lean your child forward just to allow for the fluid to flow out so it doesn't accidentally go to the back of the throat. Okay, so we have some here. We try not to advertise any brands, but I think you explained nicely how to spray. Let's use this one. We don't have to demonstrate the other one, how they would spray it in the nose.
Yeah, so what I typically say is you can put it in the nose and then angle it outward, because I don't know if you've ever hit the inside of your nose, but it's very sensitive and it's very sore. So I typically say to patients, angle it outwards and spray, and then angle it outwards and spray. And then you tilt their head back so that the medication rolls in. But usually, even if some rolls out, enough will get in there. Yeah. And it's however many puffs your ENT, your pulmonologist, your GP, or your pediatrician has said.
Has prescribed. So if this is the steroid nose spray, it is also to be used every day, just the same as the steroid metered dose inhaler. So that would be your chronic treatment for your allergic rhinitis and your asthma. Then the salbutamol and other things, the other nose spray that starts with an I, you'll use as needed. So yeah, so that's really like the most basic of things. It can get much more sophisticated than this. I got an email the other day. A mom was asking me, "Do you give biologics?" And I was like, "Right, okay, we're there now." So that's when you now need to come see us in our rooms. But otherwise,
She just Googled biologics and
do
she
you
wanted to.
understand? And I think maybe we will have to create some community awareness about that because
Yeah.
people are going to start to think that there's a cure for asthma.
Yeah.
And there still isn't yet.
Yeah.
You know,
Yeah.
biologics are not a cure, and
Yeah.
it's still
But I'm actually quite impressed that she knows that they exist.
fair.
Yeah.
Fair,
It's
but
quite impressive.
yeah, okay, no buts, no buts. All right, so thank you so much.
Cool.
I hope you'll visit us again.
Thanks
There's
for
so
having
much
me.
you and I can talk about.
Yeah, you and I do talk a lot. I know you accuse me of talking a lot, but I feel like it's both of us.
It's
But anyway,
fine.
that's another topic.
We'll allow. So yeah, guys, thank you so much. So now you'll find me either at a state hospital or at Nelson Mandela Children's Hospital or Donald Gordon, and maybe from next year, Busamed and Fontaine and Dr. Mkhubata you can find.
You can find me at Life Wilgejevel Hospital. I'm still working with another hospital currently, but that's not official yet. But Life Wilgejevel is where I will be officially.
Okay. Thank you, and don't forget to like, subscribe, and share.